You don't notice the first breath, or the second, or the thousands that follow. Breathing is silent, automatic, invisible, until one day it isn't. Imagine this. You take a breath, and it doesn't feel right. It's shallow, unsatisfying, like the air just isn't going all the way in. You try again, deeper this time. Your chest tightens. There's a dull pain, not sharp enough to panic, but wrong enough to notice. You cough. Once, twice. You tell yourself it's nothing, but inside your lungs, the space meant for air is slowly filling with fluid. And with every breath, your body is getting less oxygen than it needs to survive. This is pneumonia, and this is the moment when breathing turns into a medical emergency. Pneumonia is not just a lung infection. It's a direct threat to oxygen, the one thing your brain, heart, and every organ cannot live without. Your lungs are made up of millions of microscopic air sacs called alveoli. Each one is designed to inflate like a balloon, pull oxygen in, and pass it directly into your bloodstream. In pneumonia, those air sacs become inflamed and flooded with fluid, pus, and immune debris. Instead of air, they fill with infection. And when oxygen can't pass through, your body starts to suffocate, slowly, quietly, and then all at once. That's why pneumonia is one of the leading causes of hospitalization worldwide. That's why it kills more people every year than many cancers combined. And that's why doctors treat it as a medical emergency, not a simple illness. What makes pneumonia especially dangerous is how normal it feels at the start. It often begins like a cold, or the flu, a cough, fatigue, low fever. People go to work, they travel, they push through. But while symptoms feel mild, the infection is spreading deeper into the lungs. Bacteria, viruses, or fungi reach the alveoli. The immune system responds aggressively. Blood vessels leak fluid. White blood cells flood the area. The lungs swell. Breathing becomes inefficient, but your body compensates. Your breathing rate increases. Your heart beats faster. Oxygen levels fall slightly, Miko, but not enough for alarms to go off yet. This is the most dangerous phase because people still feel okay. Then something shifts. The cough becomes deeper, wetter, more painful. Breathing starts to feel heavy, like breathing through a wet cloth. Chest pain appears, sharp and worse with deep breaths. Fever spikes. Chills shake the body uncontrollably. Now oxygen levels are dropping fast. The brain senses it first. Confusion sets in. Thoughts feel foggy. Words come out slower. A sense of panic appears, not emotional panic, but physical air hunger. Your body is begging for oxygen. In severe cases, lips turn blue. Fingertips lose color. The heart struggles to keep up. This is respiratory failure. This is when pneumonia becomes life-threatening. And here's what most people don't realize. Pneumonia doesn't just attack the lungs. Low oxygen strains the heart, increasing the risk of heart attacks and arrhythmias. Inflammation spills into the bloodstream. Blood pressure drops. Organs begin to shut down. This cascade can lead to sepsis, a condition where the body's response to infection starts destroying its own tissues. Sepsis kills quickly. Kidneys fail. The liver shuts down. Blood clots form. Shock sets in. Many ICU admissions for pneumonia aren't because of the lungs alone. They're because the entire body is collapsing under oxygen deprivation and inflammation. Another devastating complication is ARDS, acute respiratory distress syndrome. This happens when inflammation becomes so severe that the lungs stiffen and collapse, unable to inflate properly even with oxygen. At this point, patients often require mechanical ventilation. Some never come off it. Now let's talk about who is most at risk, and because the list might surprise you. Yes, older adults are vulnerable. Yes, infants and young children are vulnerable. But so are smokers. So are people with asthma or diabetes. So are people who recently had the flu or COVID. So are people who are exhausted, malnourished, dehydrated, or under heavy stress. Even young, healthy adults can deteriorate rapidly. There are countless stories of people feeling off in the morning and being in the ICU by night. Diagnosis moves fast because time matters. Doctors listen for crackling sounds in the lungs, fluid moving where air should be. Oxygen levels are checked immediately. Chest x-rays reveal dark, cloudy areas where lungs should look clear. Blood tests show infection. Sometimes blood cultures reveal bacteria spreading into the bloodstream. Treatment depends on severity. Mild pneumonia may be treated at home, but only with close monitoring. Moderate to severe cases require hospitalization. Oxygen therapy becomes critical. IV antibiotics or antivirals are started immediately. Fluids support circulation. Pain and fever are controlled to reduce oxygen demand. In critical cases, patients are moved to intensive care. Some require ventilators, some require advanced life support. And even when patients survive, recovery can be long. Weeks of fatigue, lingering cough, reduced lung capacity. In older adults, loss of independence. Some never fully recover their previous lung function. This is why prevention matters. Vaccines against pneumococcal pneumonia save lives. Flu vaccines reduce secondary pneumonia risk. COVID vaccines reduce severe lung damage. Smoking cessation dramatically lowers pneumonia risk. Early treatment changes everything. The difference between a manageable illness and a life-threatening emergency often comes down to one decision: when you seek help. Here are the symptoms you should never ignore. Shortness of breath, even mild, rapid breathing, chest pain with breathing, high fever with cough, confusion or extreme fatigue, blue lips or fingertips. These are not wait-and-see symptoms. They are emergency signals. Pneumonia doesn't kill because it's unstoppable. It kills because it's underestimated. Breathing feels simple until it isn't. And once oxygen drops, every second matters. Before you leave, remember this: your lungs work every second of your life without rest. They keep you alive quietly until they can't. If this video helped you understand how dangerous pneumonia really is, hit the like button so this information reaches more people who might ignore early warning signs. Subscribe to The Body Brief for powerful, clear explanations about medical conditions that people underestimate until it's too late. And if someone you know has been coughing, struggling to breathe, or delaying medical care, share this video with them. Because when breathing becomes a medical emergency, awareness can save a life. This is The Body Brief, where understanding your body can be the difference between waiting too long and acting in time.